The H1N1 flu or swine flu has begun migrating to other parts of the country. Last week, the Ministry of Health confirmed 3 cases, 2 men and a pregnant woman in the Belize District. This morning, Dr. Ethan Gough of the Ministry of Health confirmed that 2 new cases have been detected in San Pedro Town and elsewhere in the Belize District.
As of this morning, we also got notification from the Central Medical Lab that they have confirmed 2 additional cases. One resident in San Pedro and one in Belize.
These 2 other confirmed cases, male, female, age range?
One is an infant, female, the other is an adult.
What are the probabilities in terms of H1N1 related deaths?
So the H1N1 flu was that was the influenza virus that caused the pandemic back in 2009-2010. There were deaths during the pandemic in people who have other illnesses that sort of make their immune system weak. So the elderly, people with underlying chronic illnesses like diabetes, people who maybe have a co-infection with a bacterial pneumonia and plus they have H1N1. So it's those kinds of situations where those patients are high risk.
So far, there hasn't been any confirmed H1N1 related deaths. The 3 persons who were diagnosed with the illness last week have been treated and discharged. What these 3 persons have in common is their travel to Mexico. The 2 men were recently in Merida, and the pregnant woman is from Chetumal. Earlier in the month, health officials across the border in the Yucatan Peninsula reported several cases of swine flu with a number of deaths.
In terms of these 5 cases that we have confirmed, they're all fine. One of the adults from Curaçao had been hospitalized and was treated. The treatment included Tamiflu, and the patient was discharged and is fine. All the patients are fine right now. The reason that we have notified the public of this is that a few months ago there was what you would call an early flu season in Honduras. It turned out that it was H1N1, and it did cause a few fatalities, predominantly in people who have other underlying illnesses. And then there was an increase in cases across the border in Mexico, and again they also had a few fatalities. So we got word in the media of the situation in Mexico. We have asked our health regions to review their plans and prepare for a potential increase in cases, make sure they have Tamiflu in stock, make sure they have the necessary lab materials in stock to take specimens so that the lab can test and so that we can confirm whether these people are H1N1 or not. So we've kind of been preparing in anticipation that eventually it would come here, and now we have confirmation that it is here.
According to Dr. Gough, the Ministry of Health has been putting the appropriate measures in place to address the situation. There is, however, the anticipation that the number of cases will increase.
We are monitoring it closely. So far, we have not seen so far any increase in the number of people presenting with respiratory infections at any of our public facilities so far, but we're anticipating that we probably will see an increase sometime soon.
Testing is being done in Belize. Specimens are no longer being sent to Trinidad and Tobago. This increases early detections and reduces the turnaround time and cost. So what can you do to not catch the swine flu? According to Dr. Gough, it all comes down to hand hygiene.
So wash your hands regularly, particularly before touching your mouth, nose, or eyes. So the parts of your face that the H1N1 virus can enter your body through. So before and after touching those specific areas, if not, just wash your hands regularly with soap and water. And if you have any respiratory symptoms, in the case of flu, I would say fever and cough primarily, then seek medical attention.
Reporting for News 5, Hipolito Novelo.